AJR and the AJR News Network welcome you to Wellness Wednesday, North Central West Virginia's premier medical talk show, presented by Fairmont Regional Medical Center, the only hospital in West Virginia to be recognized 4 years in a row as a top performer by the Joint Commission. Now, here's your host for Wellness Wednesday, Kyle Wiggs.
And it is a Wednesday, the 11th of November, and we present Wellness Wednesday, sponsored by Fairmont Regional Medical Center on WAJR and the AJR News Network. Our guest this morning is Cindy McCarty, and she was recently appointed Chief Nursing Officer. That was earlier this year, in fact, just very recently. Currently serving as Director of Case Management Services for Fairmont Regional Medical Center and appointed Chief Nursing Officer. And Cindy's in the studio with us this morning. Good morning. Thanks for joining us on Wellness Wednesday.
Good morning. Thank you for having me.
Just a few minutes on your background. I found it very interesting. We were talking before we went on the air. Morgantown, West Virginia natives, right?
That's correct. My husband and I both went to Morgantown High School and had the opportunity to move back when the opening at Fairmont Regional became available.
Okay. But your life's journeys have taken you to warm weather climates, Florida and Texas, right?
Absolutely. I actually got my nursing degree at Florida State, then got a double master's at St. Leo College, which is based in Tampa, and recently have been a consultant in San Antonio at Methodist Hospital System. Okay.
What brought you back to the state of West Virginia? We hear this time and time again, people yearning to come back.
Absolutely. My home was in South Carolina, and I was actually working in San Antonio. My husband was in South Carolina, and I made him a promise if we moved again, we would move back home, and are thrilled to be back here and be able to bring my expertise into the community. It's a great blessing for me.
Okay. The opportunity at Fairmont Regional Medical Center, just talk about that. It is a growing, thriving community there at that hospital, and we've presented many of the good things that the folks there have been doing through the months. Just talk about what the experience has been like for you there and how you've seen it grow.
I have a very strong for-profit background. I'd worked for some great for-profit companies, and as we all know, a for-profit company bought Fairmont Medical Center recently, and due to my level of expertise and experience with the for-profit industry, it was a good match. The Fairmont Regional Hospital is widely supported by the community, and there's a huge potential there. It will never be an open heart institute. It will never be a huge facility, but at the same time, the community and the community support in that area makes it such a great potential for not only the for-profit industry, but for the community itself.
Mm-hmm. That's the key. I mean, becoming part of the community, getting yourself ingrained in the community.
Absolutely. Ken and I bought a cabin in Barrackville, and my uncle, who was an ICE, they basically founded Barrackville. So for me, it's coming back to my roots, and I'm very happy.
All right. This is a challenging time for healthcare, not only in this region, maybe more so in this region than others, mm-hmm. but all throughout the country. There's just been so many drastic changes. And you're there to help Fairmont Regional Medical Center navigate through these issues. What are some of the primary issues that you see?
It's not only helping the hospital, it's helping the patients themselves. So many patients are Medicare beneficiaries, and they really don't understand if they get involved in an HMO, how that affects them and how it affects their benefits. You know, we are stewards of the Medicare Trust Fund, and being stewards of the Medicare Trust Fund, we have to make sure that Grandma's money that she put into it for 50 years is spent appropriately. We shouldn't be doing testing that we don't need to be doing. We shouldn't be buying wheelchairs and such that aren't appropriate. So we have to look at it not just for the sake of the hospital, but for the sake of the patient, and consider ourselves stewards of the trust fund.
And each patient, each situation, each medical condition is different. So you dig in there and find out truly what's needed. Correct?
That's absolutely right. That's you don't want to obviously overutilize the resources or underutilize the resources. I always tell the physicians I work with, shoot with a rifle, not with a shotgun. If someone's there for particular diagnoses, we want to do everything possible for that diagnosis. But you don't want to shoot with a shotgun and spraddle paint everything just because they need this particular test. It's not appropriate, and it's a misutilization of resources.
Mm-hmm. All right, let's go through some of these issues, some of these terms that I'm not familiar with. First being the bundled payment programs. That seems to be the direction that the healthcare industry is heading into. What is that exactly, and how has that changed from the way people are used to doing business?
A bundled payment situation is where the episode, and that's the buzzword now in the healthcare industry, is episode. Episode will take you from the physician's office all the way through the hospital experience and all the way through the discharge planning process. That bundled payment will be actually divvied up among the physician, among the hospital, and among the discharge resources. The plus side of that is that I think everyone will be a little bit more cognizant of how they spend the money. The downside is if there's an opportunity to possibly miss, for example, discharge planning. Discharge planning is on the back end. And if a patient really needed to go to inpatient rehab, but it was more cost effective to put them into a skilled nursing facility, there is the opportunity for us to lower the level of discharge planning services because it would benefit the overall bundled payment. And so that's a concern for me. So there are pluses and minuses in bundled payments.
Okay, when you talk about an episode, let's just say I have a son who's in a football game, he breaks his arm, and that process goes from maybe the urgent care to an orthopedist to a specialist and then to the hospital perhaps for surgery. Take us through that process and how all of that works.
Well, if you think about the electronic medical record, which is also tied into the episode format, you're going to start at the physician's office, and from that, of course, the initial medical history will flow from the physician's office into the emergency room, into the orthopedic surgeon and your son having surgery, and then physical therapy on the back end.
Right.
But if the bundled payment is X amount of dollars, is he going to get all those physical therapy treatments he probably does need, or are they going to cut him short because, in fact, we're sharing payment? So that sounds very. I hate to be the naysayer, but that's my concern: is that it's still utilized appropriately for the patient.
Yeah, and that's what you talk about when you get into the HMO situation.
Correct.
It's not unlimited. Like you say, you get X
Right.
number of dollars.
Well, again, what I try and my grandmother, she worked at the AMP at the bottom of High Street for years and years, but she signed up for an HMO. It's the same pool of money that you've always put into your trust fund. They're just going to manage it for you. But there are management fees that are going to be absorbed. There are things you're going to give to get that prescription card. For example, you may no longer have ambulance reimbursement because you got a card for your prescriptions. It's up to you what you want to give and take, but I think in all honesty, they need to be very forthright about what they are giving and taking so the elderly understand that.
Yeah, part of this is taking ownership of your own situation. Is that correct?
It's accountability.
Is that accountability?
It's
That's
accountability.
a better word.
Yeah, we actually encourage patients to come back after their discharge and meet with our team at Fairmont Regional, meet with the respiratory therapist, the physical therapist, and come back because we do want them plugged in and engaged in their own health care.
Okay. Inpatient versus observation.
That's a status, and it's very difficult for the elderly or any patient to really understand. Outpatient is observation. So when you're admitted under observation, the nurses don't treat you any differently. You're in the hospital, you're in a bed, and there's no way for grandma to know what status she's truly in. The downside is it's only a diagnostic tool. It's a diagnostic tool for the physician to say, okay, I'm truly going to admit you with an abdominal problem, or I'm going to discharge you, because he has that window of 24 hours to actually make that determination. The problem is the payment structure under observation is totally different than inpatient. So when grandma gets home in 30 days and gets a bill under observation, it's very confusing because she was in a bed at the hospital and now I'm being billed for PO or by mouth products. It's difficult for them to understand.
And that's part of what you do, right, to try and help sort this out
Right.
and help people understand.
There's actually a letter that we present at the time of admission that explains to them you are in observation status and you will be responsible for these particular items. Do they understand it all the time? Probably not, but at least we do our due diligence to make sure they understand.
Yeah, that's the key, is being upfront, right?
Absolutely.
Trying to get people
Total
to understand.
transparency, and that's when we revisit the HMO issue. It's total transparency.
All right, we are with Cindy McCarty, Chief Nursing Officer at Fairmont Regional Medical Center. And this is hard. This is confusing. It's hard to understand. So I'm sure you are available. People on your staff are available to answer these questions. You hope you don't have an emergency. I mean, hopefully there's a time to plan if you need a medical procedure. But it's always good to find out as much information as possible.
That's right. Every hospital in the United States should or does have case management services. Those are registered nurses that are familiar with the finances and the reimbursement piece.
367-7100. That's the number for Fairmont Regional Medical Center, and you can reach them at 367-7100, and they're located at 1325 Locust Avenue. We'll take a break. We will continue with our conversation. Cindy McCarty is with us, Chief Nursing Officer at Fairmont Regional Medical Center. We'll continue the conversation after this on WAJR and the AJR News Network.
Back to Wellness Wednesday, presented by Fairmont Regional Medical Center on WAJR and the AJR News Network.
Wellness Wednesday for this Veterans Day, November the 11th. And Wellness Wednesday brought to you by Fairmont Regional Medical Center, 367-7100. That's the number to call. They're located 1325 Locust Avenue in Fairmont. Cindy McCarty's been our guest, Chief Nursing Officer at Fairmont Regional Medical Center. And Cindy, we've talked a lot about the changes in the industry, how patients are treated, how things are billed, the responsibility financially and otherwise continues to grow for individuals. I mean, people need to play a part of, obviously, their health care, take care of themselves the best they can so they can avoid situations.
All the managed care products, of course, encourage preventive care. You know, that is the way of the future. You know, this particular market and this community is unique. In all the other markets I've worked, you know, there's not as much of a COPD problem. Here it's extensive because of the history of the smokers in the area. So it is unique in a lot of ways. But again, we can't say that all of the responsibilities on the patient itself. You know, we have Obamacare in place that actually has increased insurance premiums for many individuals to the point where they can't even afford health insurance, and it was supposed to be the end-all, catch-all of everything. So really the way of the future is going to be determined probably by the election and whether or not Obamacare stays in place or not. But when you're mandated to pay a $1,500 insurance premium, and it's cheaper for you to pay the fine actually than it is for your health insurance, what is the benefit there? There is no benefit. You know, we don't have preventive care, we don't have health insurance, and we're paying fines that we shouldn't have to be paying. And I don't mean to get on a political agenda, but I think that the future of healthcare will be determined by the election. Yeah,
and it hits a small state and a small community, perhaps, you know, even more than most places, because, you know, they're, as you mentioned before, there's a lot of people that rely on their Medicare, and it's just different here. It's hard to get by.
It's a completely different community. The for-profit company that I am blessed to be working with, they're based in California, and when we have corporate phone calls, their market is so different than ours, and we can't compare apples to apples, because even the discharge services, we have, 2 or 3 nursing homes in the area. They may have 40 in the county. So you're not playing apples to apples. It's a unique community, and that's probably why Ken and I love it so much. But the fact that we do have our own nuances in healthcare, they need to be addressed, and they need to be addressed on a community level.
Okay, where are we going in 10 years? You mentioned this 2016 election, very, very key in terms of the future of healthcare nationwide and particularly in this state. But where do you see it eventually carrying 5-10 years down the road?
Again, it's really going to be dependent on who's in the White House. I do see that, in my own personal opinion, Obamacare will be revoked. We need to go back to the insurance companies being allowed to bid and being allowed to do business on a basis where they can compete with each other. Competition is always a good thing. But the episode, again, and that's the buzzword we talked about 10-15 minutes ago, the episode is going to encompass from the doctor's office all the way through, which is the direction that we're going. That means that there will be hospital representatives probably in the major admitting practice offices, so they can monitor the patients from the physician's office all the way through discharge. You know, hospitals are penalized when a patient is readmitted within 30 days for the same diagnoses. So we want to make sure that we're doing the appropriate discharge planning to keep those diagnoses in the level of care they should be.
So some of that responsibility falls on you.
It does. You know, and if I didn't love what I do, I wouldn't be so passionate about it. But, you know, again, there's some accountability in the patient, but there's a lot of accountability in making sure the healthcare services that are provided are appropriate.
All right. Obviously, Fairmont Regional Medical Center, a smaller community-based hospital. There are some obvious differences between larger facilities, teaching-type facilities. What are some advantages that you might have that a smaller community-type facility may have?
We're blessed because we cater to the community. We understand the community. There's a huge spirituality in Marion County, and we have a wonderful chaplain program 24/7. There are little personal touches in the OB department, in the nursing staff itself, that you lose in a huge teaching facility. We will never do open heart, and we probably don't want to, but we do have the availability to be there for the patients, give them the explanation, and give them the post-hospitalization care that they really truly enjoy and they deserve in that community.
We've had many of the physicians come through here. We've had ER physicians
Dr.
come through.
Fiersby,
Exactly.
right,
I mean, there is a personal touch there.
Absolutely, absolutely. They're passionate about it from the emergency room all the way through the discharge process, and we want to give them that extra time and give them that little personal touch that is what a community hospital is all about. You know, when you have a baby there, that's the beginning of your healthcare experience, and that's what a community hospital truly represents.
And we've also had many people come in and talk about the wonderful services provided to cancer patients.
Oh, absolutely. The oncology program is stellar. We have a palliative care nurse that just works with palliative care. The chaplain program has been expanded, so when there's any real direct change in your diagnoses, you have the availability to talk to a chaplain. You may not want one, but if you come in for a head cold and find it might be a lot worse than that, you want the availability to talk to a chaplain or anyone that is going to give you the support you need. So, you know, we have the time, the luxury, and the staff to be there from anything from a fetal demise all the way up to a change in diagnoses. We want to be there for the community.
367-7100, that's the number to reach. Fairmont Regional Medical Center, 1325 Locust Avenue in Fairmont. Cindy McCarty has been our guest, and your career path has taken you to the south, to Florida, and to Texas, back here home in West Virginia, and I know you seem to feel very, very good about that.
I'm blessed to be back and be able to share the expertise that I've enjoyed all these years in my home. It's a blessing to me.
And again, moving forward, the future of your facility looks very, very bright.
It is very bright. We're thrilled to be on the upside now. We have a wonderful parent company in California that wants us to have the absolute best and wants us to be the absolute best. So we have the luxury of having a large corporation behind us, but also the luxury of being community-based and serving our community. So it's the best of both worlds.
All right, very good. Thanks for your time. It's been very informative.
All right, thank you very much for having me.
Thanks for coming in. That's Cindy McCarty, Chief Nursing Officer, Fairmont Regional Medical Center. Again, you can reach the facility at 367-7100. And thank you for sponsoring Wellness Wednesday on WAJR, the AJR News Network.